Hey, it's Mickey with Motion Restoration. So in today's video, I'm going to be showing you how to massage someone who has tennis elbow. So first thing you want to do is find a lotion that has good amount of glideability, or just coconut oil works perfect. So we have the arm of the affected area exposed. You're going to grab your lotion, put it between both your hands, warm it up nicely. So I always like to start at the top of the arm, putting lotion on and going all the way down into the hand. Now, if your patient has lots of hair, make sure that you are using lots of lotion for them, so you're not going to be tugging on the hair. All right, so lotion is on. First thing I like to do is lift up that arm by supporting it. So we're bringing it up and we're going to expose the tricep. So again, lots of lotion. So for this area, you can use either the heel of your hand or even just the edge of the thumb. So pushing in all the way from the top where that elbow bends all the way down into the armpit, just behind it. So warm up that tricep nicely. So after a few passes on that tricep, we're then going to put the arm back down and we're going to go to the front, which is the bicep area. So again, using that heel of the hand, and you're going to go up, all the way up into the shoulder. Now I find going nice and slow will help you to find areas of tension and also make it so you don't pop over a lot of the tendons and muscles that we have, making it a little uncomfortable for your patient here. All right, so you've warmed up that bicep nicely. Then we're gonna go down into the first part of the forearm here. So this is the unaffected side, called our flexors. So for this, I find just using the nice flat pad of your thumb, or again, using that heel of the hand if the thumbs are a little bit too, unable to do it. So working into that forearm here. Or again, you can use that thumb pressure. All along forearm. And then a great area to get into is actually that biceps tendon insertion point. So right along that forearm here, you're going to go where the arm bends, straighten it out. You can feel a little break in the muscle here, and just below that we have the insertion point of that biceps tendon. It's quite painful. I find the other areas around where we have the tendonitis tend to be overcompensated and very painful, especially for friction massage. So getting in nice and deep, going all along that ridge of that radial bone down into the wrist. So we can keep following that radial bone all the way down to relax those muscles. All right, and then an area that I found when I had tennis elbow, both my elbows. So the area that I found to be extremely painful, so we have this bone here, our elbow bone, and then we're going to come up just from that onto the lateral epicondyle of your humerus, and then just in from that, you're going to notice there's a little bit of a divot, a little valley between two different bony prominences. So this one here is the head of our radial bone, and then we have the lateral epicondyle here. So in between those 2 points, there's a little bit of a divot. That's where I want you to really dig in to that area. This is a very, very tender area. So I want you to go up, down, back, forth. The shape of a T is always what it's known for. So cross fiber frictioning along this area. So you can stay here as long as you would like, just to warm the area up, bring in more nutrients. So that area is extremely painful. Now the next area that we're going to go in is just above that. You're going to notice there's a big ridge, a big shelf where there's no bones, but it's all of our muscles in our forearms. So I found straightening that arm out, but we're going to start at the top and we're going to work our way around all of these attachments, that common extensor tendon attachments. So we're going to give, this is a great area also. Thumb pressure works quite well, or you can go reinforced thumb if it's a bit too much for you. So again, finding those areas of tension, moving slow over them will make it so you're not going to go pop, 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 pop over all of the tendons. And then just tracing them down. This is a great opportunity. Check in with the person who has tennis elbow. How's it going? How are you finding the pressure? If they're like, yeah, I can handle more, then press in a little deeper. If they're going, I'm going to hit you if you don't get off, then better back off. So find the areas of tension, ask them for feedback, and then tracing it down all the way into the forearm. There we go. So again, if that thumb pressure is too much, just using the heel of your hand all the way down into the wrist. All right, so after you've done a lot of that forearm, we're going to go all the way into our hands. So our hands are where all the attachment points of your flexors and your extensors are located. So even just doing little twists, each of the fingers. Just like that. All right, so after you've given the hands some love, then we're going to do what's called a flush. So we're going to go and push everything up into where the armpit is. So we're taking away all that stagnant blood, pushing it all the way up into the lymph nodes. This is a great way to end any massage that you do, is always pushing towards the lymph nodes, towards the center line of the body. There we go. So this is a great way to help out anyone who has tendonitis in their forearm. This might only take you a couple of minutes the first time. I know it's very difficult to use your thumbs, but the more that you practice, the better it'll be. You can also use obviously different areas, the palm of the hand, and even using the heel of your hand, the outside of the hand, anything that involves it, so it's a little bit easier for yourself, because I know the first few times can always be quite difficult for the thumbs. So this would be something that would really help out someone who has tennis elbow. Let me know how you found it, and I wish you all the best of luck with it.